Hello and welcome to my Capstone presentation where I will be discussing a health behavior change in nutrition promotion curriculum design. My name is Lauren Diapoli and I'm a candidate for my Master's in Applied Nutrition at the University of New England. I just want to apologize, you will not see me because the driver for my front-facing camera on my laptop isn't working, unfortunately, but you will be able to hear me though. Okay, so here's a brief overview of the presentation's content. I'm going to provide some background. I'll discuss the course content, implementation, and limitations to the design of the curriculum, and then a brief conclusion. It's been estimated that up to 800,000 deaths could be avoided each year in the United States if individuals were adequately educated on the national dietary recommendations and how to follow through with them. Healthy dietary and lifestyle habit adoption is proven to prevent morbidity and mortality from chronic widespread diseases like osteoporosis, certain types of cancers, type 2 diabetes, and heart disease. Sadly, despite the data that links dietary habits to disease progression, Americans still fail to meet the dietary recommendations. Mitigating disease development or stopping the progression of disease often requires lifestyle recommendations that include the development of healthy dietary habits and lifestyle behaviors for the long term. Health behavior change is best effected when we provide a combination of education, skills building, and design all of that around information obtained from multi-level assessments. Medical providers, dentists, and nurses are on the front line of chronic health conditions. So the target audience for this proposed curriculum is undergraduate students who are studying to become healthcare professionals. This could be nursing students, medical school students, dental students, or really any other health field where they're going to be playing a role in their community as a resource for healthy practices and as a wealth of knowledge on dietary and lifestyle behaviors for health promotion. Beyond the knowledge of evidence-based practices for nutrition and health promotion, health professionals also have to be able to engage in empathetic, interpersonal, patient-centered communication. Although healthcare practitioners might be able to translate clinical data to patients and provide them with general nutrition advice, they're often not trained in ways to address lifestyle recommendations from a holistic perspective. There are numerous contextual forces that influence an individual's health, so patients have to be assessed from a larger scope. Obesity and chronic disease rates that plague individuals worldwide are reflective of numerous complex influences. So this health behavior change curriculum will provide future healthcare practitioners with a solid foundation in the spirit of motivational interviewing, which I will go into a little further in a later slide. It will also provide them with information about how to use the principles of motivational interviewing in patient-centered care. It will also inform them of the stages and processes of behavior change as they relate to the complexities of the diet-health relationship. And the curriculum will span 5 modules, allowing the students who are new to health behavior change theories to explore and gain competencies in the health belief model, the trans-theoretical model of behavior change, the social cognitive theory and the social ecological model, and techniques for effective goal setting. Each module will contain a lecture, related readings that will be available in PDF format, and assignments. The course learning objectives are for students to become familiar with the principles and spirit of motivational interviewing to foster patient-centered collaborative relationships. They'll also explore the models and concepts of behavior change in nutrition promotion and apply the findings of relevant research to promote patient self-efficacy and positive health behavior changes according to patients' unique conditions, perceptions, and internal motivation. Students will understand the value of and theories behind effective goal setting for health promotion. So on the first module, students will learn about motivational interviewing, which can improve the doctor-patient relationship. Motivational interviewing has shown to heighten the efficacy of patient consultations and promotes behavior change in a variety of healthcare settings. So students will learn the principles and the spirit of MI and engage in activities where they will practice using and identifying open-ended questions, reflective statements, and summaries, rolling with patients who are ambivalent to change. The health belief model was one of the first theories that was designed to understand the use of preventative health services. It's based on the idea that individuals are only as motivated to change as they perceive a threat to their illness. This diagram of the health belief model is from the textbook Health Behavior and Education, Theory, Research, and Practice by Glens. This is a book that I used to design the curriculum. There aren't any readings from the book, but I've used it along with 3 other textbooks to help design this curriculum. In Module 3, students will begin to understand where patients are in processes and assessing their readiness to change, which can help make them better informed intervention designs. Students will be able to engage in assessment of hypothetical patients utilizing the trans-theoretical model and recognizing determinants of change, mediators of change, and how to recognize and guide hypothetical patients and hopefully future patients down the road towards behavioral and experiential processes of change. In Module 4, students will gain the ability to determine strategies that are congruent to patients' psychosocial readiness and their self-efficacy, utilizing the social cognitive theory. They'll also learn about and identify conditions that influence a patient's behavior and be able to propose multi-level interventions through the scope of the social ecological model, and both of them are listed here on this slide. In Module 5, which is the final module, students will explore the elements that contribute to effective goal setting. They will be able to determine goals that are SMART or specific, measurable, attainable, relevant, and timely or time-bound, which relate specifically to the patient's health conditions and their intended outcomes. Students will have the opportunity to thoroughly explain the spirit of motivational interviewing in a report format, and they'll also complete 2 quizzes, one which allows them to demonstrate their understanding of the principles of motivational interviewing, and the other one will assess their understanding of stages and processes of change, as well as self-efficacy and behavioral and experiential change processes. There are 3 case studies as well, which all have a few questions each. These assignments give students the chance to apply what they've learned in the assessment and intervention implementation design of hypothetical patients according to the status and conditions that are outlined within the case studies. There's also a summary table that students will complete, and that reflects their comprehension of the models, theories, and concepts that were explored throughout the lectures and readings. In the beginning of the course, students will be prompted to research available resources, and they'll be given some examples as well and some areas that they can look for resources. And they're going to use that to share with their patients depending upon specific conditions, health concerns, or multiple variables that contribute to a patient's ability to adopt healthy behaviors. They can use these in the future, and they'll also utilize them in this class when they present a hypothetical patient of their own in a case study format. They're going to indicate beyond the patient's sex, age, and some socioeconomic conditions. They're going to outline influential constructs that have contributed to the patient's current condition. And then they're going to frame an intervention around either the trans-theoretical model, social cognitive theory, or the social ecological model. Within this construct, they'll then provide at least 4 resources that would help their specific hypothetical patient according to the needs at different levels of the model that they're utilizing. And that assignment is outlined fairly well in the that module's content, so they'll get a good idea of how to prepare a PowerPoint presentation that will provide information about resources for their hypothetical patient. And that should be a fun assignment, I think. Finally, the last assignment, students will be engaging in a patient-centered counseling session with a simulated patient. So this will be an actor who has a fairly general script that they're going to go through, and the student is going to be encouraged to place an emphasis on their motivational interviewing skills, utilizing the health belief model, social cognitive theory, social ecological model, and the stages and processes of change and techniques for effective goal setting to help this simulated patient in empathetic, patient-centered communication. While there is a lot of published data to support the need for advancement in nutrition education for healthcare professionals, unfortunately, there were limited studies published where the healthcare professionals were educated on the exact content that this course discusses. But all of the models, theories, and concepts that are discussed throughout these modules are well supported throughout journals and literature relating to nutrition education and promotion. You can find these in the reference section of this presentation. There is a lot of data to support the need for health behavior change theories to be utilized in weight management interventions, in interventions where they are trying to encourage children to eat more fruits and vegetables, even interventions that attempt to decrease soda intake, utilizing these models similarly to the way they have been used to decrease cigarette smoking has been effective in health promotion. So it is important for healthcare practitioners to be able to utilize these models, methods, and concepts. But the hypothetical nature of this current curriculum doesn't really provide us any information to determine the efficacy of the course on how it improves future healthcare practitioners' health promotion skills, because I don't have the students to actually follow through with the course. But if this course was to be implemented, it would provide feedback, because I've designed a pre-course and post-course survey, which would be administered obviously before and after the program, and that would be utilized as a curriculum outcome assessment. And I have that over here on this slide. It's the pre and post course survey that would be used to assess the outcome of the curriculum, which is obviously to increase future healthcare professionals' ability to engage in patient-centered counseling for the promotion of health through dietary and lifestyle behavior changes. The student will not be tested on this with real patients, but they will be given the opportunity to show comprehension through assessments of their assignments, and also through the simulated patient conversation, which will also provide another method of the program's assessment of effectiveness. I know this is a little small to read, but I just wanted to give you a general idea. I used a Likert style scale survey here to determine their knowledge prior to the course and after the course. Here is a link to the website, which includes the syllabus. It has every lecture on it. It has the weekly outcomes, and all of the readings are in PDF format. It also has the assignments on there as well in full detail, including the quizzes and case studies. So if you'd like to browse around and take a look at the curriculum, you can follow this link here. So general practitioners, nurses, specialty care physicians, and even dentists all have the ability to decrease morbidity and mortality related to a variety of chronic diseases. Heart disease, diabetes, stroke, hypertension, and certain cancers are all related to dietary habits, and they could be prevented if Americans had the knowledge and the skills to successfully adopt the dietary recommendations as outlined by the Dietary Guidelines for Americans. This means that healthcare practitioners must be equipped with evidence-based information, but also have the confidence in their effectiveness of their nutrition counseling abilities. Interactive training programs, which blended teaching methods, improved healthcare practitioners' self-reported knowledge of patient-centered counseling and the stages and processes of change. So this course was designed as somewhat of a blended class that I'm hopeful will be very effective at improving future healthcare practitioners' competencies in these areas. Here are my list of references. I have 2 slides on this. A lot were used. And then there's also a quick slide of photo references. I want to thank you so much for watching. I hope you got something out of this. If you have any questions, feel free to contact me. Thank you so much.